Hi, my name is Eunice Vere and I've just completed my Master's in Global Health and Management. As part of our second semester, we had a chance to compete for some work-based placements with some international organizations. I had the opportunity to take part in a work-based placement with DIVA Medical Center, which is based in Uganda. The placement project was developed to meet DIVA's organizational goals and to meet my learning objectives. I did a healthcare worker skills gap analysis at DIVA. Once I finished the gap analysis, I had an opportunity to develop a thesis project with the organization. My project was a case study of DIVA as a private for-profit health provider to assess if they used clinical governance standards as defined by the World Health Organization in providing a basic package of care to meet universal health coverage. The project included interviews with service users, which is the patients, and the Ministry of Health officials, and then an assessment of the health center as well. The project was jointly funded by the University Graduate School and DIVA Medical Center, which was a very exciting opportunity as it meant that I was able to travel to Uganda to do the field research. I arrived at DIVA Medical Center on a wet Friday afternoon. Staff at the center were great and so supportive. There were a few challenges along the way. The weather was great though, so it definitely made up for it. It was nice and hot and quite humid, which obviously did wonders for my beautiful skin. I had to remember that it wasn't a holiday, of course, and get some work done. One of my challenges was that there was a lot of background music, as I like to call it, in my recordings when I was doing my interviews. People had some very interesting, funny ringtones that were going off through the patient group discussions because everybody didn't want to switch off their phones. So you also had some people that brought their children, so you had like nice little chatter in the background as well. Plus obviously the local neighborhood noises, which were very, very, very loud. So that made it very interesting when it came to transcribing my interviews. This project gave me a great opportunity to develop myself and use all of the skills that I'd learned over the course of the year. And I finally understood what was meant at the beginning when they said making the most of your masters. The project obviously was exactly what I had proposed and developed and as well as conducted, and as such it was exactly how I wanted it, and I gained a lot of confidence in managing sort of future projects as well, and it really put into perspectives exactly what I want to do with my global health course, and obviously opened up opportunities to be able to define my future career prospects. But overall, Uganda was an amazing research experience. But there was also room for shopping, as every girl would like, for some gifts for some people, though they haven't received them yet. Food was amazing, organic and fresh. I had tilapia straight from Lake Victoria. There was fruits everywhere, honestly juiciest pineapples, papayas, passion fruit, and I also discovered one called jackfruit, which was really sweet and very, very nice. Though it wasn't a holiday, I did make time to visit Jinja, which is where the source of the Nile is, Nile River, and had a beautiful boat ride out there. And I finally had to say goodbye to all the friends I'd made, and obviously my very loud neighborhood where I'd been staying while I was doing my research project, which was always busy and crazy all the time. I had an amazing time with all my new friends while gaining some wonderful research skills for my future career.